Okay, it's my pleasure to talk to you today about a study that I'm just getting started with my research team. The title is Preparing Families for the Dying Process, and it's a study that we're going to be doing in the intensive care unit, one of the intensive care units here at the University of Maryland Medical Center. My program of research is focused on families and what families go through as they participate in the decision-making process and the end-of-life process with a loved one who's critically ill with a life-threatening illness or injury and is in an intensive care unit, and then decisions need to be made about palliative care and end-of-life care. So I recently received funding from the National Institute of Health, the National Institute of Nursing and Research, to conduct this study. It's an R21 funding. I have a wonderful research team that's going to be helping me with the study with physicians and nurses from here at the University of Maryland, from the Michigan State University, Oregon Health Sciences, University of Washington. And I have a great clinical team over at the University of Maryland Medical Center that's going to be working with me as clinical advisory board members and providing clinical guidance on the study as well. So we're just getting ready to start the study. What we're doing is finishing the touches on the educational intervention that we're going to be providing to our families in order to help prepare them for what to expect after a decision is made to stop treatment. And then there's a period of time between then and when the dying process would begin, and this intervention is specifically designed to help prepare families for the dying process, and then also to provide support to families just before treatment is withdrawn, and then during the dying process, and then after the patient dies or their loved one dies. So it's both an educational intervention and a support intervention designed to help families. There's some pretty solid evidence that families obviously going through experiences like this have extremely high levels of stress, anxiety, are at risk for depression, are at risk for their own health issues afterwards, including post-traumatic stress disorders. And what we're trying to do in the intensive care setting is look at how can we support families as they have to make these difficult decisions and as they anticipate the loss of their loved one. So anything that we can do, I think, from an intervention perspective to help families may prove to be beneficial for the family well-being afterwards. Families have obviously a very difficult time with these experiences, so whatever we can do to support them is something that we want to do. And we're hoping that this intervention is one intervention that will prove to be helpful for our families. If you want any information about the study, you can find my information here at the University of Maryland School of Nursing website. Please feel free to email me or give me a call, and I thank you.